Hi everyone, it's Lisa. Welcome to my channel. My first appointment for my bariatric visit was to see the health specialist, and I thought I'd just put up a few things that they asked me, or where I was supposed to be heading towards in getting a lot healthier for bariatric surgery. So the first thing is they asked me why I wanted weight loss surgery. And at first I thought, what the hell sort of question is this? Like, really? Look at me, I'm like enormous, I'm struggling with food. It shocked me, really. I thought, okay, well, because now I had a few things that were wrong with me. I was having a lot of cellulitis infections, as I've mentioned in my earlier video. Where the tummy has become swollen and infected. I was unable to shift the weight each time. I've dieted so many times. It was just unreal. I just wanted to be healthy, like everyone, I'm sure. So when I had my first appointment, I had actually lost 6 kilos from after I'd been in the hospital. Now, they gave me a food guide, which pretty much had on there, you had to have, how you have a nutritional panel, I suppose, on the packaging for when you buy anything. And in there, their guide was to have less than 2 grams of saturated fat, right, and less than 15 grams of sugars, which I thought, okay, well, this could work. Whereas in the past, I've just looked at carbs itself, but not actually at fat, grams, or sugars. So they gave me that, and it's a pretty basic guide. I thought, really, this is where I've been going wrong, possibly. Looking at the wrong things in the guide, and coming up, 1 plus 1 and coming up with 11. So over the years, I'd done many different weight loss regimes. You name it, I did it. And I think from doing those different ones, I kind of gotten confused. By now, I'm like, oh my God, which one is actually going to work for me? And I never found the right one. I never found the right way. Not for the long term, anyway. So it's all about the fat grams and the sugar and cutting out, bread, kind of thing. So basically, I just got to the stage where I couldn't make healthy, conscious choices myself. I don't really know what I was looking for when I was trying to change my lifestyle, change my eating habits, just confused. That's what I was. So because I tried everything to lose weight over, more than 10 years now, actually I'm talking more like 2 decades. It's been a long time since I've actually been able to lose weight and be happy with that. I've done Jenny Craig, Weight Watchers, tried Tangy Tangerine and ASAP drops, which were okay if you can afford that. Been on at least 4 or 5 different types of weight loss shakes, oh my God, just unreal. I've done ultrasonic lipo, which I think when I did go, I was a really extreme case. Like, there's no way in hell they were going to help me get rid of it by, heating up the fat cells, and it was just way too much. It's like unreal. The poor lady who I went to see in Sydney, she was trying her best, but seriously, it was you couldn't help me. She couldn't. You've got to be people that are kind of in the obese, but not morbidly obese like I am. Yeah. So I've tried the low carb diets, no carb, high protein diets. I've tried the Ayurveda, if that's how you say it, food planning, which was amazing. I loved that, but just, I'm not very good at doing the cooking sides of things. I know how to cook. I'm pretty good at it. I just don't like cooking. It's my big problem. So putting all these food together and spending half an hour in the kitchen cooking it, it's just a pain in the ass to me. And if I can cook it quicker and get still the same results, then I'm good to go. So I've always started off with a hissing of raw, and then I've gotten sick from the cellulitis or just boredom, really. I've been on antibiotics from the cellulitis, I fall off the wagon, and I don't get back on again. Just, failed many times, many times. And it's a vicious cycle. It's been happening to me for so long, I don't even know what healthy is anymore. Yo-yo diets, and I'm just fed up. I'm fed up with trying so hard, fed up with failing, I'm fed up with being confused about it all. It's one of those things that you either get it or you don't get it. No, I didn't. So I was quite happy to have gotten on their doing their food guides, but I must say also I had been given a list of things to eat. These are things that we encourage you to eat and blah blah blah. They wanted me to have 3 meals a day. Oh my god, how? So they wanted me to do that, and I thought, oh my lord, how am I ever going to do this? But when I look back at it now, I was really trying too hard. I'd had too much food at the start because I was trying to cram all the different things they were trying to get me to have, enough not enough carbs, enough protein, a little bit of carbs, make sure I was getting enough iron, make sure I'm getting all the nutrients and stuff from the food. When I thought, okay, I'll just chuck a bit of meat in there, chuck a bit of veggies in there, and I'll chuck a bit of this, that. Before you knew it, I had a massive plate. I'm like, oh my god, this is way too much food. So, yeah, yet again, I'm starting to get a bit annoyed with it all, and I'm thinking, why is there so much? How can anyone lose weight with this much food? Yeah, I was just not getting my head around it properly. But the first steps are to get all the information, read everything, read all the documents they give you. They are there to help. They're actually there to help, which when you first go there and you go after a few weeks and you think, oh my god, this is so repetitive, it's not funny. Didn't I mention this last appointment? Like, here we go again. And they ask you how you're going with your certain things. I'm thinking, oh, yeah, okay. Well, I'm still, and the main thing is it's like trial and error. So you get the stuff, you have a go at it, you see what's good for you and what you don't like with it, and then you talk with them about it, and they can sort of get you along the right track as to where you can cut back to help if you don't think you're doing it the right way. But the health specialist nurse, clinical nurse, is the person that kind of, here in Gisborne there's 3 of them that they prepare you for surgery, to see the surgeon. When you've had a few appointments and they're okay with how your mindset is, they've gone through things with you and you've understood what you should be doing or that sort of thing, that's when they'll put you through to see the surgeon. So yeah, I needed a few visits because I kept not quite understanding some things. I would go, because they have like one appointment every month when you go in for the appointments. So you get one a month, and they sort of give you like 4 weeks to come to grips with a routine or some sort of way of how you're going to cope with it. The main thing is to just do it healthy. Like, try, and I have gone, and I've gone downtown, and my hardest thing is to go downtown and just get basically the things that I'm supposed to get. I will go shopping with my parents, and before you know it, we're coming home with takeaways. Like, where was that on the list? It's not. So it's a bit of a struggle, just trying to stay on track, and that was my big thing right at the start. But all good now, and yeah, thanks for watching, and I'll get back to you on the next video. Thank you.